Welcome and thank you for being here today. It's really great that you've taken the time out of your busy schedules to attend this innovative discussion. And we will be talking today on innovation in community-based housing in creating communities and housing for health and well-being. So thank you for being here. Please note that this webinar is being recorded for future placement on AAG's website, as well as on our YouTube channel. And all participants will be muted throughout the discussion. Please place your questions and comments in the Q&A box at the bottom of your screen, and the presenters will actually answer those questions as we go through the actual session. And any questions that are unanswered, at the end, we will discuss those then. Discussion with the speakers will take place after the presentations are completed, and I will facilitate that discussion. AAG is very pleased to have the financial support of a number of sponsors that we would like to recognize. The platinum sponsors for this session are Alberta Continuing Care Association, Alberta Innovates, United Active Living, Alberta Blue Cross, Alberta Seniors and Community Housing Association, the Good Samaritan Society, and We Seniors, West End Senior Activity Centre. The gold sponsors are AGNA, the Gerontology Nurses Association, and the Brenda Stafford Foundation. The silver sponsors, Alberta Medical Association and Alberta Therapeutic Recreation Association, with our bronze sponsors as University of Calgary, the O'Brien Institute for Public Health, and the Brenda Stafford Centre on Aging, as well as CBI Health and Lifestyle Options Retirement Communities. Today's platinum sponsor is Silvera for Seniors, and I would like to introduce you to Arlene Adamson, who is the Chief Executive Officer for Silvera.
Thank you, Jeanette. We are very pleased at Silvera to be the sponsor of today's webinar, and certainly value and appreciate the work of the Association of Gerontology. So really excited to be here today. Today's topic is of particular interest and very close to home for Silvera, as we've been creating home and community for Calgary's aging population for now just over 60 years. So this the sense of creating home is very important to us, and certainly to the residents that we serve in our community, as our purpose is to help seniors live their very best life. And so today we have a bit of a summary of the Silvera offerings within our community, and you can see that we support independent living and supported living through to supported living, both government owned and subsidized, but also Silvera owned, where we have mixed market residents living with us, mixed income. We also have a very progressive capital development growth strategy in the organization that we continue to execute to increase the amount of housing options available to Calgarians. And very proud to have one of our very own on the panel today, our Chief Development Officer, Lauren Robinson, who will share the learnings and some of the successes and challenges of Silvera as we walk through this. So good luck today, and Lauren, and thank you all for participating in the webinar. We're proud to be at today's session with you.
Thank you very much for that, Arlene. We really do appreciate your sponsorship and sponsorship of Silvera. Right, the Alberta Association on Gerontology acknowledges its presence on the lands of the Indigenous peoples across Alberta. We are committed to ongoing dialogue and shared learning to achieve healthy aging and quality of life for older Albertans. So today we really are here to discuss this really important subject. Alberta has a compelling vision for healthy aging, and quality of life for older Albertans. And this webinar will focus on the opportunities to advance new approaches to creating communities and housing to support expectations related to a healthy population. And as you can see in the layers of policy to achieve healthy aging, we really are speaking about tiers 1, 2, and 3, which is a range from healthy individuals with minimal care needs, right through to the moderate to complex care needs and the highest care needs. And this really is Alberta's transformation agenda. So when we're actually looking at what the National Institute of Aging and how they define aging, they define it in the aging in the right place as the process of enabling healthy aging in the most appropriate setting based on an older person's preferences, circumstances, and care needs. And there are 4 pillars fundamental to aging in the right place. The first one being promoting preventive health and better chronic disease management. The second one, strengthening home and community-based care and supports for unpaid caregivers. The third one, developing more accessible and safer living environments. And then last, but definitely not least, improving social connections to reduce loneliness and social isolation. Right, so we know that as we are in the work of creating healthy communities and communities where our people can age in the right place, there are many intersections between different stakeholders in ensuring that this happens. The federal and provincial governments play a large role, local governments, municipalities, individuals, as well as communities. We know that the role of the community services is huge in actually ensuring that people can remain in their communities, whether it's in congregate living or single family dwellings. And then we know too, and we are going to hear from the different speakers today on how we approach the whole health and well-being in communities and housing, right from the development stages and the land plans for what we are going to have and where we're going to have it, so that we can actually centralize where we place these communities and give the service supports that are needed to keep people healthy and included in their community. So ranging all the way through from independent living options, and those can include both the single family dwellings as well as living options in congregate living, for example, apartments or seniors housing, right through to supportive living and 360-degree living with wraparound services. It became very, very clear to us during the pandemic that if you don't have a place to call home, excuse me, and you don't have a roof over your head, it is extremely difficult to give you the services and supports that you need when you don't have a permanent address. So in this whole webinar, we are looking at the ways that we can innovate to ensure that individuals can be supported where they choose to age. And it's also got to be something that needs to support individuals with different financial means. And that is why we need all different types of housing and different sectors of the market to provide that housing so that we can provide for those with different financial needs. Well, having said that, I would like to introduce our first speaker, Dr. Karen Lee, who's the Director of Housing for Health and the Associate Professor in the Division of Preventive Medicine at the University of Alberta. And Dr. Karen is going to actually discuss anchoring our future, communities and housing for health. Thank you, Dr. Lee.
Thank you so much, Jeanette. A very great introduction, I think, to set the stage for today's discussion. Thank you, everyone, for joining us today at your lunch hour. And I'm going to kick off the panel presentations. I'm going to share my screen, so hopefully this works. Can everyone see the slides now?
We can.
Okay, fantastic. Okay, so I'm going to start by talking about communities and housing for health. I actually am director of a project called Housing for Health, where we're working to improve housing in the neighborhoods around them for supporting healthy living and social connections, particularly for seniors. If you want more information on this, you can go to our website at UAB, so that's U Alberta, uab.ca/H4H. Okay, so to kick us off, we know that the world's population is aging, and Alberta is no exception. So by 2030, the World Health Organization estimates that 1 in 6 people will be over the age of 60. At this time, we have about 1 billion people. By 2030, we're going to have about 1.4 billion people over the age of 60. And by 2050, we're going to have a more than doubling of the world's population above the age of 60, so 2.1 billion. In Alberta, we're no different, actually. Our populations in many of our communities are also aging. By 2031, it's estimated that 1 in 5 Albertans will be a senior. With aging, and also depending on, the living conditions that we live in and what we're able to achieve in terms of our health behaviors, in those community environments, we're seeing that actually we're seeing increasing levels of chronic diseases in Canada. So 44% of Canadians, nearly half, age 20 and over, have at least one of 10 common chronic conditions. So 1 in 4 have high blood pressure or hypertension, diseases of the joint like osteoarthritis, depression and anxiety are increasing issues that we have to deal with. Thinning of the bones or osteoporosis, diabetes, more than 1 in 10 people now have diabetes, asthma, chronic obstructive lung disease, heart disease, cancers, and also cognitive issues like dementia. As I mentioned, it's not unique to Canada. Around the world, these non-communicable diseases like heart disease, strokes, cancers, diabetes, lung diseases are also the leading causes of death now, over 40 million deaths, or 74% of our deaths annually. And a large percentage of these premature deaths actually are preventable, with leading risk factors including tobacco, harmful use of alcohol, physical inactivity, unhealthy diets, and then along with those things, risk conditions like high blood pressure, overweight and obesity, high blood fats like cholesterol, high blood sugar. The reason I didn't highlight tobacco and harmful use of alcohol is over the last couple of decades, I would say we've made quite a lot of gains related to, for example, making many of our public spaces and indoor spaces smoke-free. And introduced, a lot of policies related to things like tobacco taxation. But if we look at physical inactivity, unhealthy diets, and then of course their contributions to all these other risk conditions, there's a heck of a lot more that we can do. And the design of our buildings, our neighborhoods, and our building sites, development sites are actually really important pieces of this. So we want to focus on that today. The other thing I think that Jeanette also mentioned in her introduction is the importance of social supports and social connections. So I think we typically think that, issues like the physical risk factors like physical inactivity or unhealthy eating are associated with poor physical health. But actually, there's more and more studies showing us that, something like regular physical activity is actually also protective against mental health issues like depression and anxiety. And similarly, social isolation doesn't just affect mental health. It actually is also a consistent predictor of poor physical health and physical health outcomes, including outcomes related to diabetes, high blood pressure, arthritis, emphysema. And there are even studies that suggest that, if you're socially isolated and have low social involvement, your risk of getting that first heart attack may increase by as much as 50%. So what do we do about this? Well, I think that we've done a lot of educational measures around, for example, healthy living. And we know that many people make New Year's resolutions. Top New Year's resolutions include people wanting to be more active, wanting to eat more healthily as examples. And yet they tend to fail, usually within that first month in January. And it's so daunting that often they don't take it up again for another year until the next new year, and then make resolutions again that tend to fail. So studies are showing us that community design elements are actually really important for improving supports for healthy living and social connections. So for example, when we design communities such that residential areas are close to schools, jobs, stores, recreation areas, when we connect those residential areas by good sidewalks and street crossings that are safe, that have aesthetic appeal through landscaping and street art, that those types of communities actually have much higher levels of physical activity. So it's associated with a 161% improvement in physical activity levels, but also it decreases social isolation, increases a sense of community. Often, because people are walking around more in these types of communities, they're also running into their neighbors, and there's more eyes on the street. So there's also often associations with reductions in crime and stress. Building design is also important. So for example, simple signage placed outside of elevator call areas and outside of stairwells and next to stairwells have been shown to increase stair use by an average of over 50%. In very high-rise buildings, you could actually program your elevators to skip stop so that it stops. Of course, you have at least one ADA elevator, but most of the elevators actually skip and stop only at every third or fourth floor. And studies available show that that's associated with over a 3,300% increase in stair use. Design and aesthetic interventions, if you can actually see the stairwell, if it's more visible, often seen as being safer and often promotes use as well. So visibility. And now there's actually materials like fire-rated glass that can be put on stair doors, as is shown in the picture, or even stair walls. So improving stairs can be one way actually of getting people to be more active regularly in their daily life. And, there's been studies actually showing that just climbing the equivalent of 3 to 5 floors a day is associated with reductions in overall mortality and in stroke risk. So another component of our environments that we need to think about in communities around our housing is food retail. So more and more studies showing that if you have available foods, healthy foods like fruits and vegetables that are reasonably priced through supermarket availability, as an example. It's associated with healthier diets and lower obesity rates. Conversely, if you have a lot of unhealthy foods around you, like fast food restaurants, it's associated with increased weight and more unhealthy diets in the residents living around those neighborhoods. Community gardening has been shown to be beneficial for a whole host of outcomes, from some studies showing increased fruit and vegetable intake amongst gardeners, but also there are often social connection benefits that come with that. And gardening itself is also a physical activity. And then even ensuring that our public spaces or common spaces have tap water compared to people having to buy, things from the vending machine that go into the landfill. So it's bad for sustainability, but it's often also high sugared and empty, high calories and empty calories. So, we've learned from many jurisdictions. These are jurisdictions that I've had an opportunity to work with. And you could see that they're quite different sizes, right? I've worked in New York. I've worked with the housing authorities in Atlanta and San Antonio. We've worked with housing and health working together in Mississauga, Brampton, and Caledon, very different sized communities. And yet they were able to actually integrate in healthier features and general guidelines and standards into new housing, particularly affordable housing. So we know that low-income neighborhoods often experience more barriers to healthy food access and physical activity. So if you're developing affordable housing, there are opportunities to think about the amenities that you can put on the site, or even how you locate that housing, and also what you can put in the building. That can be done. Actually, we did a cost study across New York, Atlanta, and San Antonio and found that many of the features that could promote health don't have to cost more, or they cost very minimally, very much minimally more. So feasible, low cost or cost neutral features include things like thinking about where you locate your developments, more walkable, mixed use and complete communities, or working with the municipality where you're going to develop to see what they can do about improving walkability. Shifting costs from sedentary to active elements. So for example, you see on the picture on the right side at the bottom, called Affordable Designs for Affordable Housing. Instead of just having outdoor space that's completely passive and only has, for example, seating, the affordable housing developer here actually created a little training circuit where you could do weights at some places, you could do stretching, there's some outdoor elliptical and exercise bikes, but then there's also, of course, a place to sit. So one of the stations at the far right is actually a rest station with a picnic table and some seating. Co-locating healthy amenities on the site. So for example, indoor, outdoor fitness equipment, along with play space for grandchildren. I think very often we think about maybe the seniors in our developments, but not quite who their visitors are going to be. So often developments for seniors that I've seen in the Alberta context don't have anything for grandchildren. And so grandchildren don't come to visit as frequently as they need to. So thinking about how you can co-locate play space, for example, and fitness equipment that can be used together with grandchildren and visitors. Farmers market on the ground floor or ground floor produce store, particularly if you're building in a food desert neighborhood. Encouraging mixed income developments that include affordable and market rate units. So the new model of affordable housing in many parts of the world have started to focus on these partnerships that create affordable, like the PPPs, that can create a combination of affordable and market rate units to help maintain those developments over time, using the market rate units to help offset some of the maintenance costs. So just to give you an introduction to Housing for Health, again, you can find us at uab.ca/H4H. Housing for Health is funded by the Public Health Agency of Canada, and it basically has 5 main components to try to improve our communities to support healthy eating, particularly healthy food access, social connections, and physical activity or active living. One key piece is partnerships. We have over 200 partners, most in BC, but we have some in BC, most in Alberta, so we have some in BC, Saskatchewan, Manitoba, Ontario, and Quebec. Just to let you guys know, these partners, over 100 of the 200, have been working together on healthy community guidelines that hopefully will be released later this year and available for free for you folks and others to use. We also, if you're having public events, we have these healthier food and beverage guidelines for public events that you can also utilize to help your vendors provide healthier food and beverage options. Community engagement, we do workshops and events with community residents. So if you're interested in, we do work with developers to do community engagement workshops with their residents as well. So let us know. It can be used to help generate ideas to make your development healthier, coming right from the residents. We have 3 pilot developments currently, one in Whitecourt, all market rate, but consisting of independent living on the top floor, supportive living on the 2nd floor, and on the bottom floor, we actually have dementia care units. We have Leduc, which is a mixed income building. And then in Edmonton, we have an affordable housing building only for low-income seniors. So the developments are really meant to identify feasibility of the concept of integrating these healthy strategies into these buildings and neighborhoods, working in 3 different types of municipalities and 3 different types of housing, all targeted towards seniors. Research and evaluation, we're assessing health and well-being impacts as people move in and live in these buildings. And then we've got this annual Fit Cities, Fit Towns conference in May 30th and 31st, which we hope you'll join as well, where we'll introduce the Healthy Community Guidelines and identify case studies from around the world and locally that actually can demonstrate how to implement these guideline strategies at the building site, and at the neighborhood scale. So just to share with you a little bit about the research that we've done so far in Housing for Health in some of our developments with seniors, we're finding that physical activity is very low, particularly in the winter. So, adults, including seniors, are asked to get 150 minutes a week of moderate to vigorous intensity physical activity. So moderate intensity activity is just stuff like walking or leisurely cycling, anything that gets your heart rate and breathing up just a little bit. But our seniors, at least from our studies, are getting something like 7 minutes a week. You could see how low that is compared to the requirements to keep them healthy. Presence of ice is a big barrier to walking outdoors. So clearing your ice and snow in your sidewalks around your site is actually absolutely important, and working with your municipality to ensure that the neighborhood is also cleared of snow and ice, particularly on important routes, maybe to nearby amenities, is a really important piece. Residents do walk the stairs. So I think when we started this project, one of our developers wasn't convinced that residents use the stairs at all. But in fact, they do, particularly in the wintertime, as a way to get extra physical activity. So designing your stairs to be safe and comfortable for seniors is actually really important. Fruit and vegetable consumption, very low, as you could see. Only 38% ate fruit 2 times daily, and only 5% ate vegetables 2 times daily. So increasing that access to fruits and vegetables, really important. And residents tended to feel connected to those in their building. So this was a congregate living independent facility, but not necessarily to the neighbors outside the building. Older adults do like walking. They like to walk in places where there's greenery and flowers, with company, in places safe from crime. So think about that in terms of if you're trying to promote walking and active living. Older adults view parks as healthy spaces, both mentally and physically. Fast food restaurants as unhealthy spaces. local shops as good for social connections. And often there are perceived poor access to fruits and vegetables in the neighborhood. So what are things we can do in our own developments, and also working with the municipalities in which we're located to try to improve the items that older adults want to see for health? So the Healthy Community Guidelines, just so you guys know, the goal is to give people a set of strategies that are feasible to do for buildings, for streets, for their sites and their neighborhoods, to increase supports for physical activity, access to healthy foods and beverages, and social connections. We're asking that, home builders, facility operators, developers, municipal officials, even community residents who might give inputs into new developments coming their way, use this. And health professionals can also use this to give inputs into their facilities and into their municipalities. Some examples are things like focusing on not only having residential buildings in a neighborhood, but particularly if you're going to have residential buildings for seniors or you have aging populations, thinking about all those amenities within walking distances, 400 to 800 meters, within 400 to 800 meters of multi-residential family buildings and buildings that house seniors, including recreational facilities, transport amenities, because many people stop driving as they get older. So things like transit, walkability to food, healthy food, recreation facilities, etc. And then, other things like gardening, farmers markets, professional and health services are all additional things to consider. Some core building strategies to consider are incorporation of ramps where possible. We know that people who have disabilities, and as people age, many of us do develop disabilities, have people with disabilities often have fewer opportunities for active recreation and exercise facilities. And so these daily active living measures like ramps are actually really important wherever we can incorporate them. Safer stairs that are visible from the main entrance, that are aesthetically pleasing and nice to use. Thinking about the flooring in these finishes of the stairs. And even, as I mentioned, simple signs encouraging people to use the stairs for health and or other benefits have been shown to increase stair use. Additional strategies consider are building strategies that can promote social connections. So for example, we found in our research that having balconies that protrude and allow neighbors to interact was actually really important during COVID for seniors to have opportunities for social connections with their neighbors. So building to ensure that we include such types of balconies, indoor and outdoor social spaces that allow not only the seniors themselves to interact, but for visitors who might be coming in, safe places, particularly in preparation for future pandemics. Ensuring that building amenities are accessible for seniors and people with different abilities, including, the width of doors and availability of rails and washrooms, etc. Anyways, you can take a look at this. The guidelines will be out later this year and be posted on our website. So I think overall, just to summarize, things to think about are, do you have safe walkable routes to healthy amenities like grocery stores in the neighborhood where you're locating? If not, can you work with the municipality to put those in, or can you yourself put something in on the ground floor that would sell, for example, produce? Could bring in mobile farmers markets once a week to your site, whatever. But anyways, this idea of healthy amenities nearby, walkable to them, and then places to rest like benches. You could have maps showing walking access to neighborhood healthy amenities. Walking trails are greatly desired by seniors, both on site and nearby. Gardening amenities like these elevated gardening boxes. Multi-generational active social spaces like co-locating active spaces for seniors and grandchildren. well-lit, pleasant, accessible, safe, visible stairwells, signs encouraging stair use and other healthy activities, and then balconies that allow neighbors to interact. If you're interested in more of these examples, there are case studies from Singapore, from New York, from various jurisdictions in this book called Fit Cities. There's also, you can contact us if you're interested in working with us in any way at h4h@alberta.ca. And then many of our resources can be found on our website as well. Thank you.
Thank you very much, Dr. Lee. It's really great to hear you speak and all the work that you've done on ensuring that we have the research to be able to design and build. And what I really clearly heard from you was that location is really key, and that it's an intentional and deliberate design, not only of the community through town planning, but also building design. We can't just clone buildings to all look the same in different communities. They really need to serve the purpose of the communities that they are located in. So thank you very, very much for your presentation. Really appreciate it. Thank you. And we will move on now to designing living environments for health and well-being. And we have many innovations within this setting and many speakers that are going to speak to you on the experiences that they've had and the innovations that they have produced as well. So to talk on independent living and co-housing, an innovative community approach to living well in the community, we have John Mangum, former coordinator of Age Friendly Calgary, a citizen champion, and Mosaic Village co-housing. Welcome, John. We really look forward to hearing your presentation.
Thank you very much. Just for clarity, in the co-housing model, there is no coordinator. I was just one of the active participants. And you'll probably understand why as I go through this. I wouldn't want anybody hearing that as part of co-housing. I'm going to share my screen here. Okay. Co-housing, an innovative community approach to aging in place. I think we often tend to build the same type of housing and use the same type of processes and expect different results. We need to consider other housing models that work, that don't always have to be attached to an outside organization, and that can be managed and maintained by the people that live there, like the way many people live. That inherently are great for aging in place, whereas Arlene said, people live their best lives. So what is co-housing? I think there's some confusion about that often, so I'm going to try to put some clarity to it. So co-housing is a model of housing and not a legal entity. There are co-housing condos and there are co-housing co-ops. This is a model of housing design with privately fully equipped dwellings. That's with, you know, your kitchen, your bedroom, etc. Somewhat like a typical condo. And then there's an extensive common area or common house, it's sometimes called, designed in a way that people will naturally bump into their neighbor and choose to engage with them or not, unlike a typical condo. The common house is the heart of the community, where all kinds of planned and unplanned activities can happen. In a sense, it's an extension of one's own personal space. This shared space allows your private space to be smaller, creating less of an overall footprint. So there can be planned recreation areas, and each co-housing community can figure out how to do that. Decisions are made through a consensus decision-making model. This process allows for all to participate in decision-making. It is uniquely different than how decisions are typically made in our culture. So you got a wide variety of where people are at with the decisions that you're making as you move forward. When designed right, co-housing can be the perfect balance between privacy and community engagement. And it really improves social connections. That's the point of it all. As well, it's suited for aging in place. So there are intergenerational co-housing communities, and yes, they're just seniors co-housing communities. So this is a rendering of Mosaic Village. We're not built yet, and now it's not going to be built. A decision is made not to build, and I'm going to explain this today. We plan for 24 units of 2 and 3 bedroom. We hope for diverse groups. We're aiming for low-income families and seniors, as well as a mix. There is another co-housing community in Calgary called Prairie Sky, and people moved in there about 20 years ago. Their design is somewhat different than what we planned because they weren't thinking of aging in place. So accessibility wasn't such a big deal as it is now. So why did I want this? I think it's an important question. This was an aging in place plan for myself and for my wife. And we saw this as a perfect balance between community and privacy. It would force us to downsize, which we, like a lot of people living in single detached homes, desperately need to do. And there was some natural community supports that were going to be there. That was the plan. You're going to be able to connect with people around interests, around getting things done, all kinds of different ways. I wish I had more time today to talk about this at greater depth. So maybe in the Q&A, that might be possible, I don't know. So the journey started in 2015. And by 2018, we had 11 households that wanted to buy in. We found land in Bowness that was walkable, bikeable, shops nearby, schools nearby, parks nearby. After looking at dozens of properties over a couple of years, the land had 3 poorly kept properties. 2 were so bad we boarded them up. We did not have any assistance from levels of government. CMHC funding was turned down after a lengthy 4-month process. That needs to be addressed somewhere along the way. CMHC seems to be so confusing. City land had expectations that were some concerns to us. Shutting off utilities and stoppage garbage pickup from those 2 places we boarded up was a 6-month nightmare. There was no clear direction on how to do this right. And during that time, I was trying to do that. I was working for the city and I still couldn't figure it out. So I realized how different the co-housing model was when we had to educate the developer and architect, even after explaining it to them and providing a book on co-housing. We had some big barriers. To make this happen, the entire cost of the project came out of our own personal finances, including the land and a list of professionals. The project became too expensive. To build, we needed about 75% of the people who had bought in with 20% down so we can acquire a construction loan. That's the common formula. We were not able to achieve this given what was going on in today's markets. Interest rates kept going up, increasing the cost of the mortgage on the property, which increases the price of the housing. This was far too expensive for low-income people without some sort of assistance. And we had lots of interest from low-income seniors and low-income families. The pandemic in 2020 happened, and we bought this property in 2019. The development permit happened shortly thereafter, and 2021, with all the stresses of what's going on to the pandemic and the concern this cost was going to increase, 5 families left the project. By 2022, and people leaving is not unusual as you move forward, and you have systems in place with that. But this was a sudden impact with a lot of craziness that was going on in our wider society. The cost of living was increasing by 2022, and the supply chain was becoming a concern around construction. We increased our marketing committee. We reevaluated it. We hired a marketing consultant who knows co-housing really well. We put new systems in place and promote it like crazy. Still a slow uptake. Now in 2023, the position that we are currently in is the land is up for sale and we do have an interested buyer, but this isn't going to happen right now. And this concerns me because this is the second time co-housing didn't get off the ground in Calgary, and it is getting off the ground in other places in the world. So I hope this doesn't deter people if we could do it differently. Okay, in the conclusion here, if we are serious about wanting different housing options, then we must be willing to work outside the box. We need to consider how to engage citizens who are willing to create housing options. Within the past week alone, I had 3 different people wanting to meet me to figure out how they can successfully build some sort of housing. There's a lot of interest from citizens out there. We just got to figure out how to connect with them and make things happen. Citizens are interested, and building housing is not an easy process. We know that the co-housing model works. There are co-housing communities in several provinces in Canada and around the Western world. But it will only work well if all 3 levels of government work with us. And that could be funding or land or consultation. Sometimes contacts would even be helpful. A financial developer would have been helpful. Somebody who would be willing to take a long-term investment by putting some money forward up front in order to help bring lower income people in even. Being a sideline cheerleader is not very helpful. We had times when, people in government in particular, or other people, professionals in the community says, you guys are doing a great job, keep at it. Well, sure, but we needed these other resources looking back, I think, but have been very helpful. I was not able to go into a lot of detail in it because of the limited time I have, and I wish I could do that. Maybe in the Q&A, or I can put my contact information if people are interested in the chat, and I'd be willing to follow up with some of this. Thank you.
Thank you very much for that, John. This really is a very innovative model, and I am aware of it working in several of the other provinces as well. So where does the conversation actually begin? And how do we move these things forward? It really is important that we have these types of models where people can live independently and have a choice of how much social interaction within the community and with the greater outside community they wish to have. So, yeah, I would encourage you to continue in your quest, because I do think that you potentially are a little bit ahead of where Albertans are at the moment, but I think it's going to catch up. So thank you very, very much for that, John. Really do appreciate that. Okay, so we now are going to hear from Linda Revel, who is the Chief Executive Officer for Connecting Care, and she's going to talk about an independent congregate living model that they have called 3 Robins, and that is located in rural Alberta. Welcome, Linda, and thank you.
Thank you so much. We can move to the next slide. Sorry, I don't have access to my slides, so I have a Vanna White off screen who is doing this for me, so thank you. So what I'd like to do is talk a little bit about what 3 Robins is, and it actually aligns very well with the previous 2 speakers about how do you actually create communal living. My focus today is going to be how do you create communal living in rural Alberta, because it's often an area that is overlooked when we talk about housing opportunities and how do we allow seniors who've lived their entire life in rural Alberta to age in place in the communities where their neighbors are around. And often in developing in rural centers is more difficult because access to those amenities that Dr. Lee spoke about can be challenging. So what is the difference between a Three Robins concept and a retirement residence? Three Robins is a communal living environment, which is really focused on active adults 55 and older who wish to maintain their independent lifestyle without the responsibility of home ownership and maintenance. And I think that's really critical. It is a rental environment. It is geared to low middle class income older adults, not the high end and not the low income, but the middle class. It's for that group of people. And we know based on the studies that we know that independence breeds wellness. And that's been spoke about before. Residents of Three Robins are independent adults who actually live in this community with rental suites where they can choose additional services a la carte, but they are not, these additional services such as housekeeping, laundry, meal delivery are not actually provided by the physical community in which they live. They are actually partnerships with local businesses that actually provide those services to it. So it's an automatic integration of your local businesses around the environment with that rental organization. But I do want everybody to know that these are individual relationships, and residents are not required to pay for services they do not need. So if they don't need them, it's not included. And it is always because if it's the external that they get to choose what they want, and they get to choose if they don't like that provider to go to someone else. And I think that is really important because they may want different needs. Senior care residents are usually for seniors who require higher care levels, including healthcare and all meals. And in this situation, that's not the case. And what Three Robins is really crafted is to be an option between living at home and retirement residence. So next slide, please. So the other big thing about the Three Robins concept is it really is focused on volunteering. Volunteering is built into the model. Tenants' rents is reduced by $200 per month if they volunteer 10 hours per month in the building or in the community. And again, the older adult gets to choose where they want to invest that volunteering in. There are many different volunteering activities built into the programming. And if they don't find one that interests one, they're welcome to actually create their own. And we've actually seen this. So one of the things that Dr. Lee spoke about was community gardens. In one of the residents, we actually did not have a community garden set up. And that actually was crafted as an activity that they wanted to lead. And now we have actually vegetable boxes out on our terraces in which our community gardens in that community. Every resident is encouraged to find a volunteering activity that actually they are passionate about. Volunteering can include the kitchen committee, the welcoming desk, the woodshop helpers, gardening, quilting for cancer patients, whatever they want. They actually get to choose. And I think that's the really important thing is all the volunteering activities, what is designed in the building is determined by the people who actually live there and not by the programming. Next slide. So there are a few things that are unique to this model. There is a full-time general manager, there's a community engagement coordinator, and there's a maintenance expert on site. So they are always available to the people who live there to support the vibrant volunteer community they want to create. It's handicapped accessible, it's pet friendly. There's additional storage space available because we know that as the previous speaker talked about downsizing, that is often a really big challenge for older adults. So we do offer on-site storage that is quite unique. Right now, our two opportunities that we've created are non-smoking, but could be a mix if required. And there is heated underground and surface parking available for the residents who actually live there. Next slide, please. So how successful has this been? We know that all utilities are included in the rent. Access to all amenities, the workshop, the exercise room, everything is available to them. General repairs to their suites are available to them, and equipment maintenance and snow removal and more is available to them. Next slide. So what have been our results? We are at above 94% occupancy in both of our locations. We have one in Red Deer and one in Stony Plain, and both of these communities were opened during the pandemic. There are volunteer supports that are in the Three Robins programs that are very successful. And the other thing that has been implemented, and again, this was a resident-driven initiative. They've created buddy systems in which they actually have about five residents join together, and they actually offer each other relationship support and buddying. So if they don't see that individual for a couple of days, they check in on them. There's an automatic checking in. Next slide, please. So what are the success and barriers? I fundamentally believe that this is the future of a design, especially for rural Alberta, because it optimizes that focus of rural Alberta for creating neighborhoods and creating community, regardless of where you actually live from a distance perspective from your neighbors. What are the risks? The previous speaker spoke about this. Our biggest challenge in the Three Robins concepts in both Red Deer and in Stony Plain is getting the financing in order to build the building. And unfortunately, because of the current interest rate environment that we are all in and the double-digit inflation, it's making it very difficult to keep your rents at a level that allows you to actually afford to pay your people that you have, that you've employed, and pay off your mortgage. That is the most significant issue that we're running into. It is really difficult to make these type of design models actually work financially. What are our lessons learned? There is a significant demand for these type of units within the rural context. We do need to do more work on what are the outcomes that this model creates, but these are living labs that are currently in rural Alberta that are actually working. And I know that my time is up, so I'm going to stop there now. We do have a video that'll be part of my presentation that will be available to everybody from the residents who actually live there.
Thank you very much for that, Linda. A very innovative model. I love the volunteering aspects of it, which really does solidify and create that great feeling of community, as well as being beneficial on the financial side to residents, and the relationships that the individuals also have with community businesses. So thank you very, very much for that. Much appreciated. And I'd like to now introduce Candice Christensen. And Candice is the Chief Clinical Officer for the Good Samaritan Society of Alberta and BC. And she's going to talk to us about small homes as an option for living well. Thank you.
Thank you, Jeanette. Today I will share with you the Good Samaritan experience with our small home model. Next slide. So our beginnings. Good Samaritan was a pioneer in the industry, establishing its first cottage 28 years ago in 1995, based originally on a model from Sweden that contemplated caring for persons with dementia in a familiar home-like environment that would result in improved quality of life. Next slide. At the time, our cottages were designed based on the following principles: privacy, individuality, independence, dignity, and choice. And depending on the size, our cottages that exist, they're home to 10 to 12 residents, built open concept with private bedrooms and 2 shared baths per unit. The homes were designed to create a safe and secure environment in a familiar home-like setting that includes secure in and outdoor spaces, specialized equipment to meet resident needs, consistent staffing, lower staff to resident ratios, and multi-skilled staff. The familiar home-like setting serves as a cue to memory and behaviors, and programming centered on providing meaningful, familiar activities that lends itself to the normal routines of daily living. Success with the model has resulted in expansion over time, and today we have 19 cottages in British Columbia and 25 in Alberta. Next slide. It's really great to, it's a really great start to see that Alberta's commitment in the 2023-24 budget plans to expand the small home opportunities. As we heard from John and Linda, it's time for a change given the demand and the changing expectations of residents, families, and the public at large. Certainly over time, the model of care and environmental improvements have enhanced our ability to provide services as demonstrated with the greenhouse model. Our Good Samaritan experience echoes the observations of the greenhouse model experts, and there are important considerations in moving forward to ensure that today's challenges do not become barriers to future success of the small home model, such as there are increased costs of capital construction, and that must be considered as being offset by quality of life and system benefits. The funding needs to support sufficient staffing and working to full scope with a shift to accountability for outcomes. Our education programs need to better prepare our employees for person-centered care and roles as team leaders. And finally, with the opportunity for innovation that's attached to this model, we must open our minds to think broadly and creativity about how small home living environments can be created in a range of settings to serve different resident populations with varying care requirements. Moving forward, I'm interested to see how we can incorporate the concepts for healthy communities, also as described by Dr. Lee. Good Samaritan is certainly excited about Alberta's potential to expand small home options for the community-based living and the opportunity to evaluate impact for ongoing learning for us all. Next slide. The value this model brings is homes that are centered in the heart of communities, designed for a maximum of 14 elders with private bedrooms, attached washrooms, and a central living space with access to secure outdoor spaces. Person-centered care that focuses on being and belonging, maintaining autonomy, control, and purposeful living that embraces an individual's choice and preferences, and an empowered team of caregivers that work to their full scope, assuming a responsibility for a range of personal, clinical, and home care activities. The gains, next slide. The gains are increased resident and family satisfaction and a good life, one that promotes autonomy, dignity, choice, and quality of living. The focus on employee development, such as enhanced training, engagement, collaboration, and shared decision-making, promote overall satisfaction and retention. The system benefits include promotion of aging in place, reduced IPC or infection prevention and control issues such as outbreaks, and outcomes that include collaborative, resident-directed care and other quality of life indicators that we should likely advocate be included among more traditional health-related quality of care indicators. Furthermore, enhancing the availability of small homes in both rural and urban settings again provides choice, and it will enhance our ability to meet the diverse needs of the people that will be increasingly called upon to serve. Next slide. To conclude, I'd like to recognize that other pioneers of this important concept, some of whom include Care West, Bethany Care Centre, Capital Care, Exquisite Care, and the work of Calgary's Dementia Network in engaging potential clients and providers to set out a path moving forward. Ultimately, when it comes to care, there is not a one-size-fits-all approach, but the small home model does provide an innovative alternative option that promotes inclusiveness, autonomy, dignity, choice, independence, and community connection, which is simply the right thing to do. Thank you.
Thank you very much for that, Candace. Small homes definitely need to be innovative and incorporate that concept of housing for health. Quality of life being absolutely essential, and also the need in smaller communities not to have buildings that would not be able to house the appropriate populations that they are actually designed for. So thank you very much for that. We really do appreciate the real home approach and the fact that you are looking to support the seniors that are within your environments in an independent way. So thank you very much for that. Right, and so our final panelist today is Lorne Robertson. He is joining us from Spain. He is Calgary-based, but in Europe at the moment. So we thank him for actually taking the time to share his insights into this webinar. He's going to be talking on integrating housing and community-based services in a 360 living model. And Lorne Robertson is the Chief Development Officer for Silvera for Seniors, and they're based out of Calgary. Lorne may have a few connectivity issues, so bear with us if we run into any difficulties with that, and we will help him to figure it out. So thank you very much and welcome, Lorne.
Thank you. Can everyone hear me? Can you hear me okay, Danette? I'm a little concerned about internet.
We can hear you.
All of a sudden I'm getting internet unstable warnings, so hopefully that doesn't. I'll just share my screen here and we'll get moving and hopefully get through it. I
think Jordana has shared your screen already, so.
Oh, okay. I think it's my screen that I'm sharing.
Okay.
Yeah. Okay, so we're just go through it. Just wanted to talk to you a little bit quickly. I'll be quick about Silvera. We're a housing management body in the city of Calgary. We're 60 years old, 60 years plus now, and we're home to more than about 1,450 residents in over 28 supported living and independent living communities. We have a capital growth strategy that builds on the support for growth and affordable housing, and provided by all levels of government support. But we also have a growth strategy that involves with that, looking at mixed market and how we continue to grow and support seniors. One of our key goals is the creation of campuses to ensure the integration of housing and services to support seniors to age successfully in their community. It's a one size does not fit all approach. Tying into the 360 living model is really where the conversation begins, and I wanted to pull this from the 360 living site, which design a model where housing, health, social, and lifestyle, the needs are intertwined and can be advanced together. It's not about one over the other, but it's advancing on all four fronts. The Courage website states it starts to talk about healthy with minimal care needs and multiple models, where the minimal care needs including models from multi-generational housing to home sharing and co-housing, as well as looking at moderate and advanced care scenarios. One of the things that we're going to talk about today is kind of two projects that we have moving forward, and the place to start with that is where we started with our master plan and the foundation of working through with our board and working through with key stakeholders operationally as well as from the community as to what really are the planning principles to bring forward in our developments and what should we look at. So those principles looked at the integration of independent and assisted living, to maximize land value and site utilization, to be able to make sure that we're using those assets correctly. How do we phase those projects? We can't do everything at once. They have to be able to be supported through phasing. That the communities have a sense of place, that they have a sense of community. Going back to what was said earlier about the importance of universal design and enhanced outdoor experiences, that we're always looking at resident safety and security, and we're working on enhancing the aesthetic of public areas, both inside and out of the buildings. Then we look at continuous pedestrian routes with lots of options. And we look at the connection of these communities, not only to roads, but also to regional pathways and transportation networks. So this is an image of what is currently being developed in Glenmorgan and our Westview community. And it's bringing forward all of those aspects from what was really an underutilized inner city site that starts to look at densification. that building on existing infrastructure, such as our Westview Town Suites, which was here, and Horizon Housing, but working with our partners to build other multi-generational housing, from Horizon Housing to market rental housing for all ages, to the Glamorgan campus and our new residences, as well as a higher level of care vision building to be supported. But part of this image is really about that connectivity, about how the pathways, how the buildings are interconnected, how they're connected to the rest of the community, and the connectivity of new roadways, new pathways, new bus access, transportation access, et cetera, to ensure that people have all of those, the access to all of those services that were talked about earlier. That, you know, the connection to easy access connections to the West Hill Shopping District, to grocery stores, to other services and community health services. So we created a foundation for that master plan that really started to look at those key aspects, building on our purpose and our values as an organization, but also to look at what's the priority around some of the other principles, everything from aging in the community to home-like environments, to mixed-use developments, to supporting neighborhoods and aging in place, et cetera. That we really wanted to look at what our priorities were and how they rated on the scale of importance to support that development. So through a number of iterations and a number of discussions for our site that remained within the site, this is what we landed on as our design and the response to that engagement. Building on the Westview community, building on our existing infrastructure and our additional existing supported living environment, to look at supporting residents in different apartment styles, different independent, active living environments, but to ensure that we have that connectivity to the supported living community and things. So looking at how we access the site, where's the potential drop-offs and connections, how we look at where the bus and transit activates with the site, as well as providing a number of different outdoor environments for people to reside. Creating destinations and points of interest. That we wanted to create a community hub, and that was our Westview Town Suites, was really identified as saying, how do we create that existing building of activity? Turning our insides out is kind of one of our common themes that we talk about. So, you know, as a supported living provider for the residents, you provide, you know, services 365 days a year, 24 hours a day. But how do we turn those services out and connect with the surrounding community, both within our buildings, but also to the community as a whole, going back to that larger infrastructure and connections with the larger community? So what was you know, not only responding to changing market needs, but also to look at what is the role of having an atrium? How do you bringing that outside in concept? What are some of the other aspects? The learning center, bistros, access to programming, the social, you know, to improve sociability and recreation activity and fitness. To look at how do we balance hardscape and softscape within that environment. As you know, we all live in Alberta. It's not exactly a garden spot all year long. So how do we access and ensure that we have safe access? And then how do we support the buildings long term? So with that, we started with reimagining the Westview Town Suites as a core, as an anchor to the community. So building on the atrium, it was really trying to make sure it's a site, a destination, that it's future focused, that it's modern, and it's incorporating best practices of design. So one of the concepts that really rang through is how do we create more public zones, semi-private zones, and private zones within the complex? Because we want people to be able to feel comfortable to access the environments, as well as to move through and respect individual privacy. So just some images of what's been created kind of before and after, just activating that atrium as I was speaking to the ability to bring the outdoors in, creating creative spaces for activities and engagement. the learning studio, all of these off of that public space that I talked about the access to the public domain. And some semi-private zones, activity areas just for residents and individuals, like through membership or other pieces. So some gathering spaces that are a little more private, planting, access, horticultural rooms, fitness rooms, etc., that work for not only the residents of the building, but the residents of the community. Resident suites were looked at being enhanced to be able to support aging in within their community, provide flexibility, a home-like environment. Bathrooms are upgraded to ensure, so one of the major principles was universal design. So not only wheelchair accessibility in some bathrooms, but universal design principles captured throughout: lighting, accessibility, modernization. So that was our Westview site, which we looked at as an inner city site. We're largely focused on densification and starting from an established community and building connections to an established community, and that being able to utilize transit and other elements to connect. Our Greenfield site, suburban site, if you want to call it, is in Livingston. And one of the things that we wanted to talk about today was, how do you do this from scratch? How do you start looking at some of that feasibility? And just for people's context, I know from projects being built, in that document, in that picture of the urban site, most of those buildings are already built. They're either under construction or being built or planning. The only one that's really not in that final stages is the higher level of care building on our site, which is still in conceptual design. But starting with the Greenfield site. So again, coming back to these principles, they hold true for everything that we're doing, whether it be new or whether it be redesignation or redevelopment of an existing site. So for those that don't know where Livingston is, it's as far north as you can go without hitting Airdrie, is basically the best way to describe it. It's actually north of Stony Trail. It's on the center line. And I think this is one of those areas where we really wanted to focus, was having our mandate is to serve all Calgarians. And to do that, we needed some suburban options. The aspect of one of the attractions to Livingston is not only is it one of Canada's fastest growing communities, but it's also connected and will be connected to major traffic arteries north and south, east and west, not only roadways, but also public transit, as it's adjacent to the Green Line. So the site has a number of amenity spaces, and this is one of those aspects to look at. And looking at Livingston by the numbers, future population of 30,000 people, 7 schools, 200 acres of parks, a total size of almost 1,300 acres. So when you're looking at a community, it is its own city in many ways. Some of the other aspects that were really important, and one at the top is the Homeowners Association facility, the Livingston Hub, and that the community itself has a hub, over 35,000 square feet of a homeowners association that's designed as a central gathering space for residents and guests as part of the community, that features fun amenity spaces and gathering spaces to support families and others to come together in the community. That we have a number of parks, and walkability is important within the community. It's designed for togetherness. It's connected and accessible, and it supports the live, work, and play philosophy, as that not only is it's got a large element of residential, but the future capacity has envisioned a large amount of office and other types of environments to support along the Green Line as that's developed. So as we looked at our site alone, and one of the things that our site is right on 144th Avenue, which is the major east-west connector, so for transit and other routes and connections. It's also looking at it from a multi-level diversified site. It's for the future, that it has different types of housing, from townhouses to supported living and other other services as part of an Envision master plan. Currently, we're on our first building. We're in that building that's been funded through Rapid Housing Initiative as well as through AHHP with the province. So we're looking at the first phase of Livingston, total of 63 units when it's completed, of apartments and independent, but incorporating within that is tying these amenity spaces and tying both indoor amenity spaces within the building, but also building those concepts of outdoor amenity spaces, both more private, sheltered from the weather and dealing with the elements, being on a hillside, raised planter beds, etc., to support seniors to engage in outdoor activities, but also to have connections to the community. One of the things is looking at some of the near amenities to it, not only being on 144th Avenue, but it's also immediately adjacent to a new school site, as well as a number of parks and other active areas. So, and within walking distance of the Livingston hub. So all of those elements are being brought into that connectivity of the housing within the community as to why Livingston was important to us. That's that quick presentation to take us through as to what we're looking at and how we're trying to build connections with the community. The connectivity is extremely important to Silvera and to our planning, and to bring services, not only for us to provide services to the broader community, but for us to be able to bring services in and support our residents in a number of different ways. Jeanette, I'll turn it back over to you.
Thank you, Lauren. It looks like Jeanette might be having some technical difficulties. So I'm just going to pull up Marlene here.
I hope everybody can hear that. When you're in presentation mode, I'm not sure it's working or what's happening with the internet. So I hope it went through okay.
Marlene, it looks like Jeanette has some technical difficulties, so we are defaulting to you with our Q&A period.
So I would ask, are there some questions in the chat? I haven't been able to see them, but I'm thinking I would like to ask the speakers very quickly if there's one thing we should take away from today to mobilize communities for health and well-being, what would it be? And then we'll have the closing slides. One thing. Very quickly. John?
I mean, I'm talking to the converted here, I know, but it needs to get out in the world that if you want to start with health for seniors, you got to start at housing. You don't start at hospitals. And if you want people to age in place in a healthy way, start at housing.
Karen? One thing.
I would say that you know, when you're thinking about either building new housing or you're thinking about renovating, these are all opportunities where the health and well-being of seniors should be front and center. And there are strategies you can put in immediately that don't have to cost you anything, or very little more, that will make a tremendous difference in supporting, I think, seniors in their health being more protected through especially 3 key protective factors of social connection, active living, and healthy food and beverage access.
Thank you. Linda?
I think we need to actually create winning conditions for housing success. I do think that, especially for seniors, where we're not using traditional models. I think that there's great ideas. I think everybody wants to do the right thing, but we are hitting roadblocks from a financing perspective, from the sustainability perspective of these models, that we need to engage with the developers, and we have to engage with the people who the lenders, to actually make these viable and sustainable, or nobody will invest in them. And that's one of the biggest problems that I'm seeing. Or we're going to have to charge seniors too much money. There's got to be a middle ground here for people to live healthy. That's not just for the rich.
I think these are really good concluding comments. Candace, anything to add? Or I'll go to the closing slides. Candace, and then we'll go to the closing slides.
Agreed, Marlene, with the comments made. I think the only piece I would add is the person-centered, creating environments that take it from being a house to a home, culturally sensitive places where people can, be themselves.
Thank you. We've had some technical difficulties and we apologize for that. With the time, Jordana, I would like to have the closing slides. This is the best closing slide. Keep calm and hope the internet works. No, keep calm and transform the future of aging in Alberta. That's really important. That's what this webinar is for, and that's what we're here for. The next slide. We'd love to see you as members of AAG. It's a membership run organization, supported organization. Check us out on our website. And I think the next slide is our last slide. Thank you for being here. Thank you to our speakers. I really like those closing comments. They can become our call to action. You will get a survey after this webinar about what's important from your point of view to move forward. Please answer it. We want your opinion. We do a summary report from each webinar. It's on. We take it to our stakeholder collaborative committee. Government sits there, and I want to share. We have evidence government is listening. There's more to do, and your input here as speakers and in your survey feedback gives us further direction of the work before us. Thank you very much for being here today, and here's to good housing first.